When someone has a fracture, we do a surgery for some fractures. We sometimes apply a plaster and treat it conservatively. So which fractures need a surgery? Which fractures don't need a surgery? Fractures are operated when there's a lot of displacement. So if the displacement is more than 50%, generally it requires an operation. If the displacement is minimal, we sometimes don't tend to operate. Pediatric fractures, we generally tend to conserve. Kids heal very quickly with just plaster of Paris application. So kids get less surgeries than adults because their healing potential is much better. Periarticular fractures. When there is a fracture around the joints, we don't accept even 2 millimeters of displacement. When there is a fracture around the metaphysis, we sometimes accept up to 5 millimeters, 1 centimeter of displacement. Periarticular fractures generally require an operation because if you don't operate them, the patient will lose movements in the joints. Open fractures. Whenever the fracture is open, such is a fracture which has to be operated because it has come in contact with the external environment. Chance of infections are very high. Those are emergencies. We operate them within the first 6 hours. We give them a thorough wash and fix those fractures, and those are open fractures which require surgeries. Undisplaced fracture and well-aligned fractures are the ones which don't require a surgery. Undisplaced is when the fracture has not moved at all. Alignment is whether the area of contact is good, but it is not in a proper alignment. So undisplaced and well-aligned fractures generally don't require surgery. We put them on a plaster of Paris cast, or sometimes we will give them belts and treat them conservatively.